Hi, it's Dr. Dan Cooper here, and I would like to thank you for tuning in. Today I'd like to talk to you about thyroid and thyroid evaluation. I've had a number of patients recently not even recently, I've had a number of patients over the course of my career, and it always comes in this way, where they say, I've had the full thyroid panel done. I hear that term a lot, full panel. And my doctor told me this. And when they end up showing me what they've gotten done for their testing, they have a completely incomplete set of tests that have been done. Let me tell you what is really necessary for a full panel to be done. So, TSH is what is typically done in a thyroid panel. Well, TSH is thyroid stimulating hormone. It is produced in response to your body's perception of the level of thyroid hormone that is present in the blood. So, when your body perceives there's not enough thyroid hormone available, TSH is produced to tell the thyroid, produce more hormone. Well, there's more components to this than just that. So let me give you a little background on what the thyroid produces. So we have T4 and T3. T4 is the inactive form of thyroid hormone. T3 is the active form of thyroid hormone. When the thyroid produces its product, thyroid hormone, it produces both of those, T4 and T3, but it produces a overwhelming majority T4. Now, luckily, a majority of that is converted to T3 at distal sites in the body, the liver and the gut being the two biggest sites where T4 is converted to T3. And then it is usable. Once it's converted into T3, we can use it for the body functions that uses thyroid hormone. Well, if there's dysfunction in the liver, you get junky conversion. If there's dysfunction in the gut, you get poor conversion as well. So, if that's the case, and you only did a TSH test to evaluate your thyroid, you would show up as being hypothyroid, when in reality, you're having a poor conversion of T4 to T3 because of dysfunction in one of your other organ systems, such as the liver or the gut. So, when we do a thyroid panel, you need TSH, you need free T3, you need free T4. It would be nice to have thyroid binding globulin to see if some of that thyroid hormone is bound up and unavailable for use. And then it would also be useful to add in thyroid antibodies, so anti-thyroid antibodies to the panel. Because if you do show as being dysfunctional in one of these ways, you don't want to have to add an extra test. So you just throw them all in the same panel and then evaluate. So the treatments for somebody who's a poor converter, I'm kind of harping on poor converters because that is a majority of our hypothyroid patients. I get patients all the time that are deemed hypothyroid. They've been labeled this diagnosis as hypothyroid. They're given thyroid hormone, Synthroid, some thyroid preparation to make up the difference. But the actual reason that they're presenting as hypothyroid hasn't been elucidated properly because the appropriate testing wasn't done. And if they're under converters, we're not addressing the poor conversion. We're just artificially supplying thyroid hormone to bring their levels up to some physiologically functional level. But what good is that? Is it good? I mean, it's good for the time being to subside whatever symptoms are occurring because of the hypothyroid, perceived hypothyroid situation, so the lack of active thyroid hormone being available. But is that a long-term solution? I wouldn't say so, because what it does is dictate that you're going to be on some pharmaceutical intervention for life then. If you don't actually address the underlying cause, then you're just stuck on the pill or the shot or whatever the thing is to supply what's missing. So you go a step further, and if you find that someone is converting poorly, then you have to evaluate these other organ systems. So you do that. And then you address the other organ systems. And it depends on what's going on, what the treatment would then be. But that's your long-term fix. You correct the underlying system that has become dysfunctional for whatever reason. You correct that dysfunction, and then just cruise on with your life and be a normally functioning human. And that's what I've got to say about that. So if you find yourself intolerant to the cold, you had hair or skin oiliness changes, you've got dry skin, you've got brittle hair, you've got hair that's falling out, you've got changes in the menstrual cycle for the females, if you have Mood shifts, energy shifts, and typically if it's hypothyroid, it'll be a decreased energy. Hyperthyroid would be increased energy. So if you find yourself with these things and you're wondering what's going on, it might be worth a full panel, a full evaluation of thyroid to be done to see if that's the culprit, since the thyroid has a ton to do with metabolic rate and the energy systems. It also influences the other organ systems a lot as well, so it's one of those linchpin systems that you really want working at its optimal. So that's what I've got to say about that. If you have questions, give me a shout. If you want to come in and get it checked out, do that as well. I'd be happy to help you. Thank you and enjoy your day.